The first question is something that I've actually heard from lots of people, and it is, what is the difference between a heart attack and a cardiac arrest? And so I think a lot of times, even in TV and things, they kind of use the terms interchangeably, and they are actually quite different. So I'm going to start by talking about a heart attack. So a heart attack is when part of your heart muscle is not getting blood and oxygen, and as a result it suffers, and eventually, if it doesn't get the return of blood and oxygen, it can die. And so that's what a heart attack is. So our heart is a hollow muscle, okay, and there's 4 chambers. The biggest by far is your left ventricle, and it pumps blood out to your body through your aortic valve and through the aorta and all of the blood vessels that feed our body. So it is by far the biggest chamber of our heart, and it requires the most fuel because it has the biggest mass of muscle and it does the most work. So we have on the outside of our hearts these things called coronary arteries. And they're called coronary arteries, just, well, here's some trivia for you. If you actually look at a heart, around the top third of the heart, there's a ring of arteries, and then they have branches that go down and feed all the way down to the bottom of our heart. And this ring around is actually, they call it a crown. So coronary is Greek, or corona is Greek for crown, and so they're called their coronary arteries. There's a bit of trivia for you. And so these coronary arteries are on the outside, and if they block off, that's the most common cause of a heart attack, because if they completely block off, no blood gets past that blockage, and that part of your heart muscle, if it doesn't get blood returned to it, it will die. And that's what a heart attack is. The medical term is called a myocardial infarction. Myocardium is heart muscle, and infarction just means death. So an MI is also a heart attack. So the most common cause of a heart attack is a blocked artery, and the most common way that an artery becomes blocked is that we build up plaque inside of these arteries. And that happens over a long period of time, and that can happen in any artery in our body. And the driving forces are these things called risk factors: high blood pressure, diabetes, smoking. All of those things tend to irritate the inside of those arteries, and they're supposed to be nice and smooth. But if they become irritated, they kind of get inflamed and rough, and can have little cracks in them, microscopic cracks. And then cholesterol that flows through our blood can kind of get into those cracks and build up behind that inner smooth layer of the wall of the artery. And it can eventually close down the artery and make it smaller. It's typically not just plaque that makes it block completely. Usually what happens is that you get something called a plaque rupture, and so that inside skin, we'll call it a skin, that inside layer that has all the plaque building up behind it, becomes unstable, and it can rupture or break. And if that happens, our body tries to repair it, and the way it does that initially is by trying to send clotting factors there and build a clot and try and repair it, just like if you cut your finger, same idea. Unfortunately, in an artery, it often blocks off blood flow down that artery, and that's why sometimes you can have pain that comes on all of a sudden. And that's your heart attack. Sometimes you can get pain that is a warning sign. It comes and goes, and you may have a clot that's coming and going, and then eventually it blocks it completely off. And so that's the most common cause of a heart attack. It's called a plaque rupture. You can also have the inside of that wall tear away and actually block off the blood flow down the artery, and that's called an artery dissection. And we call it a spontaneous coronary artery dissection, or SCAD for short. Different kind of risk factors for that. I'm not going to get into that too much. And there's actually sometimes you can have, you could also just have a clot from somewhere else that can come and get into that heart artery. It would have to come from the inside the heart and happen to go down your coronary artery and block it off. That's pretty rare, but it can happen. And one other way you can have a heart attack is just by having a narrowing, not a complete blockage. But if for some reason you may have low blood volume because you're bleeding, or your heart's beating so fast that it just demands more oxygen, you may not have a complete blockage, but your heart may become damaged because it's just needing so much blood and it's not getting it, and that's called a demand heart attack. Not too common, but it can happen. So that's a heart attack, is when a part of your heart muscle dies. I told myself I wasn't going to drone on too long today because I talked about heart failure and I talked about AFib, and that was all I talked about last time. I went on and on and on. So that's what a heart attack is. Now, a cardiac arrest is when your heart actually isn't pumping blood out effectively or at all. And so a cardiac arrest can be caused by a whole bunch of things. Now, a heart attack could cause a cardiac arrest. If you have a blockage way up at the top of one of the main arteries that comes down and feeds your heart, that may be enough to make your heart go into an abnormal rhythm, or enough of it die that it just, usually it's an abnormal rhythm, and then it's just not pumping effectively, and that is a cardiac arrest. And there's different rhythms that can cause a cardiac arrest. I try not to get into that too much. You could also have other things that aren't heart related at all that can cause a cardiac arrest. And now, if you're a nurse or a doctor or somebody who goes through advanced cardiac life-saving, you learn about things called H's and T's. And so most of them are medical words that start with H and T. But I'll try and give you a couple of examples of other things that can cause a cardiac arrest. So the H's, they can be a number of things. So we call it hypo or hyper, different things. But if you have hypoxia, so that's a lack of oxygen in your body. So that could be from a drowning, and that's a very common cause of a cardiac arrest for a child, is that either they choke or usually they may stop breathing for some reason, and then that causes their heart to not pump properly, and usually it's an arrhythmia that just your heart goes into cardiac arrest. You can have really low blood sugar, hypoglycemia. We'll go through the H's. Sometimes electrolyte imbalances in our blood, and potassium is a very common one. So hypo or hyperkalemia, that's what high or low potassium in our blood is. Kidney disease can cause changes in our electrolytes. Hypothermia, so if you are exposed in cold weather, that can cause a cardiac arrest. So those are most of the H's. I actually wrote them down here to try and make sure I got them all. Yeah, or acidosis, which is another imbalance in our blood, which it could be caused by not breathing or different things. So the T's are more related to trauma stuff. And so some of them can cause pressure on our heart. So our heart actually would normally pump fine, but if you have something called a tamponade, that means blood collects around your heart. There's a sac that goes around our heart. And if for some reason blood's collecting, usually it's because the heart muscle has a hole and it leaks out of the heart and collects in this sac. It puts pressure, and the heart may be trying to pump, but it just can't because it can't move. So that's called tamponade. Same kind of idea with something called a tension pneumothorax, where your lung fills up with air on the outside and pushes on the heart and it can't beat appropriately. Another one would be low blood, I missed one of the H's, low blood volume just from trauma. So if you're bleeding out, your heart actually may be working fine, but it's not pumping anything out, so that can cause a cardiac arrest. Sometimes chemicals, so if you have an overdose of different chemicals, whether it's intentional or non-intentional, can cause you to cardiac arrest. And we'll get to the one that we call it thrombus. That's the other T. And so you can have a blood clot in your heart artery that I already mentioned. A heart attack could cause a cardiac arrest, or you could have a blood clot in your lung, what's called a pulmonary embolism. So those are kind of other things outside of your heart. I mentioned thrombus, but other things outside of your heart that can cause a cardiac arrest. So the next time you're watching ER and they say they're having a heart attack and their heart just stops, it may not be that they're having a heart attack. It may be that they're having a cardiac arrest from one of those other things. So you can try and be real smart and say, well, it could be a heart attack, but it could be something else causing their cardiac arrest. So that's heart attacks and cardiac arrest.